on a Nova piece back in 1990, narrated by Stacy Keach. Let's play that clip and get one of the top bioweapons medical doctor experts out there, Dr. Stephen Hadfield, who trained the FBI, who's a major consultant to African governments right now in their response. He's saying he doesn't think it'll be as bad as some of the media has been saying, but that there's a terrible response to it. He's been very critical of that. I want to get his take on that and take some of your phone calls. But first, let's play this clip since he was mentioning the Reston strain that they believe did go airborne. Here it is.
In 1989, Ebola made its way to the U.S. Residents of this Washington, D.C. suburb had no idea that one of the world's deadliest viruses had emerged in their midst. In a primate quarantine unit in Reston, Virginia, monkeys in one of the holding rooms suddenly began to die. Secretly, a military team entered the quarantine unit and killed all 60 monkeys in the infected room. The crisis heightened as monkeys began to die in a different room. It appeared that the virus was moving through the ventilating system. In response, the military killed all 400 monkeys, ending the outbreak.
All right.
This new strain of Ebola had shown the potential to spread through the air.
Let's go back to Dr. Stephen Hadfield. You were pointing out that this does not make humans sick. I know there's a lot of strains of Ebola. You have been critical of the response. Why has the response been lackluster?
I think our guard went down. The people that handled the arrested Ebola outbreak from USAMRIID, United States Army Medical Research Institute of Infectious Disease, this was the aeromedical isolation team, or what became the aeromedical isolation team. These were highly skilled technicians wearing totally appropriate positive pressure ventilators and the suits that went in and cleaned this mess up. And the AIT team was built, trained, and put on standby to fly anywhere in the world to aeromedically transport an Ebola case or other hemorrhagic fever case back to Fort Detrick, where there was a biosafety level 4 treatment facility. So everything was handled completely. In fact, the isolator that would come off the helicopter would seal to the outside of the building, and the patient would be brought in for biosafety level 4 care. Physicians from Walter Reed, highly experienced, would come up, put on the spacesuits, and, top flight intensive care. In 2010, for some reason, that was shut down. That capability was lost. And there was really nothing to replace it.
So you're saying that's why all the default measures weren't there, is because we don't have them anymore? So we had them before we spent $120 billion, but now we spent $120 billion, we don't have it.
Yeah, essentially. We have 4 designated biosafety level 3 treatment areas scattered throughout the country. But we kind of lost capability there, and it wasn't just the fact of the facilities. You had people that were practiced and rehearsed and confident in their equipment. It's hard to work in those suits and to try to put a tube into somebody's lungs, an intubation. When you're wearing a spacesuit, it's a little bit difficult. These physicians had practiced, rehearsed, and there was an area of calm about the entire thing because we knew you were fully protected. When you handle these type of infections under a less than biosafety level 3, decontamination is very, very, very important.
Well, that's my question. They had to know that nurses and people were going to get Ebola if they're treating Ebola patients that are in the final stages, bleeding everywhere, like the patient 0 that died in Dallas. I mean, they had to know. And so when Obama comes out and says everything's going to be fine, it doesn't create a lot of confidence. I've talked to medical doctors on air and off air saying that when they see people with Ebola symptoms, that there are CDC teams showing up in spacesuits, taking them out in the middle of the night and telling them don't talk about it. We've had them on record. The media attacked us. Now Forbes is reporting that they were at a CDC press conference and that they met with reporters, AP and others, and they said we've all agreed to cover up new Ebola cases. I agree with you, and I'm no scientist, but I don't think it's going to spread everywhere and be super big deal. But at the same time, why would they then be leaving the planes open, not stopping the visas like you've written and said they should? Why then would they be covering it up on one hand while letting it come in on the other?
Well, I have not heard anything about a cover-up, but let's look at it this way. When Mr. Duncan, the patient that died in Texas, 2 nurses were secondarily exposed. My understanding for the one nurse that flew from Texas to Cincinnati and back, that 800 people had to be contact traced by epidemiologists. That's one case. Putting a quarantine will never be totally effective. But when you build a defense for this type of thing, you try to have it in layers. Just like a military camp. You have claymore mines out on the periphery, and then you have trenches and interlocking arcs of fire. You have layered defenses trying to reduce the potential number of cases. Canada has put in, it's my understanding, they put in a national quarantine there. It's our elected leaders have chosen not to do that. My worry is that not Ebola, but other cases, other diseases. If one patient on an aircraft took 800 contact tracings, how many patients flying on aircraft infected would it take to overload our national and state's capability to perform contact tracing? It's fairly labor-intensive, finding out who this patient had come in contact with.
Sure, at a certain point, you get overwhelmed. So,
yeah.
I mean, the default, correct me if I'm wrong, is you stop the visas from the 5 countries affected. A bunch of other nations have done that, from England to Australia, and been criticized. The African countries have done the same thing. Yeah. People that come in that show signs, you quarantine them. Yeah. And it's not that it's going to 100% stop it, but like you said, it's putting up layers of defenses so it doesn't get in, spread out of control, and then you can't get it under control.
Well, even with quarantine, you must expect cases to get in. But it's at a manageable level for your national and state resources. Now, we've used fever as one of the criteria and thermal scanners in the airports. But the published literature, outbreaks in Uganda and this present outbreak, New England Journal of Medicine in October 16, 2014 is probably the most up-to-date. And they report that in 12% of cases, Ebola can present without fever. And the absence of fever is not a reliable indication that an individual is not infected.
Sure, because Advil or Tylenol can knock it down, right? That's what they're saying as well. I mean, not just that.
I don't know about that in the pharmacological interreactions. I know these some non-steroidal anti-inflammatory agents can reduce fever. Tylenol can do that.
Sure, but I mean,
but to use this as a sole mass screening when 12% of the cases may not be showing a fever. So again, it's part of defense, but. And the SARS outbreak, I mean, fever was a presenting sign there. And Singapore and some other countries were very, very quickly able to get on top of this. Or it could have been really quite a public health disaster for Singapore. And when they home quarantined somebody over there for the SARS virus, they had people phoning every hour the house. And if you weren't there, and you were supposed to be under house quarantine, the police came by to get you. And so we know how to handle these things. We've known for 100 years.
What do you make of this nurse? Well, the doctor in New York has a fever. He's at bowling alleys, the A train. He's at restaurants, and then he lied about it reportedly to the police. I mean, this guy's a medical doctor out of a hot zone. He's got a fever. What is he thinking running around?
I can't comment on that. I don't know the details of the case. But we do know that skin shedding of the virus can occur. In advanced cases, you can take a skin swab off someone, and using fairly non-sophisticated techniques, it's got a big long word, immunohistochemistry, but you can see Ebola virus in the skin. The virus replicates in certain cells in the skin, and your skin has a growing layer, and it sheds, and you're constantly flaking dead skin cells off.
Ugh.
And these Langerhans cells, the virus replicates inside them. It goes outside the Langerhans cells, and it can get pushed to the surface.
Dr.